Healthcare's Tina Verona. Thank you so much for joining us this afternoon for our media briefing. We have assembled a group of experts today to answer all of your questions. We have, of course, Dr. Ulysses Wu, our Chief Epidemiologist here at Hartford Healthcare. We also have Eric Arlia, our Vice President of Pharmacy here at Hartford Healthcare, and also Dr. Lucia Benzoni, who's a pediatrician here at Hartford Healthcare. We're going to, of course, start it as we always do with Dr. Wu to give us the latest on the numbers across Hartford Healthcare and where we stand with hospitalizations today. So Dr. Wu, it's all you.
Thank you. Where's Tracy? Usually she gets the numbers. No Tracy.
There's still time. She may call.
All right. Well, Alex is on. Hey, so, all right, let's go through the numbers. We got Bacchus at 43, Charlotte at 15, Hartford Hospital at 130, Midstate at 37, St. Vincent's at 38, THOCC at 40, Wyndham at 7. So that brings us, we have actually 5 at Natchog, none at Bradley. So we are actually down 18 from the day prior. Actually down 19 if you include Bradley as well. Now, the good news on the state side is that we've actually decreased under 1,000 hospitalizations for the state. But we have to remember the message that not all of these people that are in the hospital are there for COVID reasons. And our numbers, our internal numbers show that anywhere from probably about 30 to 70% on any given day may be there for completely different reasons. So that number is actually starting to creep up, which is why I said the 70%. So we're starting to see more people that are asymptomatic from a COVID standpoint show up in the hospital for whatever ails them at this point. You always ask me about my predictions, still not changing it, still a long tail, still a long sawtooth pattern. And that sawtooth pattern we actually saw over the weekend. We had a little bit of a bump in ICU cases across the state, as well as ventilator utilization. And so, but that is again back down. And so we will continue to see that, but the numbers for the actual COVID positives continues to go down its downward trajectory. So I'm sorry, I'm being redundant there at this point. I don't think I have anything else from the epidemiology, so I'm going to stop talking right now.
All right, Dr. Wu, thanks for that update across Hartford Healthcare. We have been receiving a lot of questions this morning surrounding the latest headlines regarding a possible Pfizer vaccine for children under the age of 5. So we have brought in Dr. Lucia Benzoni, our pediatrician, along with Eric Arlia, as I mentioned in the beginning, our VP of Pharmacy. Dr. Benzoni, I want to start with you on your thoughts. So,
am I unmuted?
Okay. Yes, you are. Go ahead.
So my thoughts are that it's a very good step to think about the immunizations for children. I think the way that it's being put forth is that this 6 months to 5 years is these 2 first shots are immunobridging. And I do think parents are going to have a problem with that, because immunobridging means that what they're seeing is not a full, robust immune response. And parents are going to say, why then would I do an immunobridge and not an actual immunization for my baby who is already getting so many shots at 2, 4, 6 months? I do think that it's going to be an issue. And I spoke to my office manager as I came in here. She has an 8-month-old. And I said to her, Olivia, what would you do if it was your child and you wanted to protect him? She said, I would wait. I would have to wait and see what happens more.
And Dr. Benzoni, you had mentioned, this is a very personal decision and it's one that you have with your patients. Explain a little bit about that process that you go through with your patients.
So with each parent that comes in and expresses concern, I try to meet out what is your actual concern. Are you concerned about the side effects? Are you concerned about all the long-term things that I get that question all the time? What are the long-term side effects? And anyone that's being honest will say, we don't know, because this is a relatively new vaccine. From the data that we have so far, there are really basically none, but we don't know. And I think patients always appreciate honesty from a physician, and they want their honest opinion when they come in. When they come in and ask me for a personal decision, I talk about who is in your family, who's immunocompromised, who do you live with, who watches your baby. And those reasons and those things in their personal life may change my answer to them. So someone who has a grandparent that's watching their child who's maybe has COPD or diabetes, I may say to them, maybe worth this to start your child getting this immunization, even if it is immunobridging, because what we know so far is that the vaccines are not causing a lot of side effects in over 5 years old. And in my practice alone, there's been a very good response to the 5-year-old immunization. We've had a large proportion of our patients ask for it. So that's been very good. But as far as an outright blanket immunize your child, I think for myself, I would have a hard time when the Pfizer saying it's an immunobridging and the first 2 vaccines are not robust immunologic responses, where is in the other immunizations that we do at 2, 4, and 6 months. The reason why we do them at those ages is because the immune response is so robust at those ages. And so what's the difference? Why? We don't know yet. And for some parents, it might feel like that this is an experiment without an informed consent. And I know that's kind of strong words, but that might be how it feels to parents. Parents have strong feelings when it comes to their children.
Dr. Bensoni, what is your advice to parents out there seeing the headline?
With these headlines, what is my advice? I would say keep asking the questions. Every time you come in, or if you see a headline, send me a my chart message and I'll answer you in my chart. Keep watching the headlines. And I would, again, it's a personal decision, and we review with each parents their personal lives.
Thank you, Dr. Bensoni. Eric, I want to bring you into the conversation, our VP of Pharmacy, in terms of, we heard I saw in the Washington Post that some are saying it could be the end of this month. What are you hearing on your end, and sort of what would that rollout possibly look like?
Sure. So I think we can just do a little bit of reset of exactly what came out in the Washington Post article today. So as I understand it, Pfizer has been encouraged to submit the 2-dose data for emergency use authorization. I don't believe they've done so yet. I'm not sure what their plans are going to be. We know that the addition of a 3rd dose is currently being studied. It looks like we might have the preliminary data on that in March. When it comes time to roll out a vaccine, there's a couple of questions that we need to answer. The first thing to know is that the dosage form for this vaccine, when it does eventually receive authorization, is different from the pediatric vaccine we have now. The dose is lower. It's a 3 microgram dose as opposed to a 10 microgram dose. They need to make that in a different concentration, because if you think about giving a vaccine injection, you need to be able to measure it appropriately in the syringe, and the amount of volume needs to be appropriate for that size child. So it's not unusual that you will see different dosage forms as you move through age categories like this. So in the pharmacy world, what we'll be looking for next is any intelligence, which we usually get through the Department of Public Health, who still holds regular briefings with all of us, on when that dosage form might be available. I remember back in October, when the pediatric vaccine was being finalized, we did get some information before the final authorization came through. So I don't think it's out of the question that either in the next week or 2, we might get some information on when we might see that dosage form. The next thing that I would be looking for is I would be looking at the ACIP committee of the CDC, their meeting calendar, to see when meetings are being planned. If you remember, I think we've all come to learn this over the last year and a half. It's a 2-step process to approve a vaccine. A vaccine gets either approved or authorized by the Food and Drug Administration, but that's not the end of the story. What happens next is that the ACIP committee of the CDC, which is a group of national experts, will weigh in on whether they endorse use of it in whatever population is being studied. And then finally, that last step, it needs to be signed off by the director of the CDC. So we all remember from the PD vaccine, there was a hearing during the day from the ACIP committee, and then later that evening, the director signed off on it, and that's when we were able to start giving those. So there's clues out there. We've all become very knowledgeable about the process. Like any process, there's a lot of logistical and operational steps. that need to take place. So that, I think, will give us our clues as to when it'll become available. And, you know, I can't imagine, I think all of that will take at least several weeks. So we might be coming close to the data on the third dose being available by the time everything is ready to go. It'll be interesting to see how it times out. You know, perhaps by the time we're able to have the vaccine in stock and work with our pediatrician partners to have it available, we'll be getting more information. And really, in fact, what we'll be able to do is just get people started on that 3-dose series a little bit earlier than if we wait for the finalization of the study. I think, you know, that's my opinion of really what the FDA is thinking about in encouraging Pfizer to move forward.
Eric, thank you.
Yep.
Dr. Wu, I see you nodding your head. Do you want to chime in?
Yeah, no, I agree with that. And I do want to just highlight a few key points because I don't want the message when people read the articles, you know, to get a mixed message what it is about the vaccine. So first thing I want to say is that the vaccines are safe. They're not awaiting additional data to see if it is safe for everybody. They're awaiting additional data to make sure that it works. It stimulates the appropriate immune response that they are looking for. And so there is obviously a lot of precedence because there's a lot of vaccine series that we already give to ourselves and to children as well, where multiple doses are needed. But I don't want the message to get lost that we want to make sure that you all understand that the vaccines are safe. That is not the reason why they're awaiting additional data from that standpoint. And so what they're looking for, because we do know that it's safe, is that can we stimulate that appropriate immune response? And so I just really wanted to really clarify that.
Thank you for that clarification. We're going to open it up now to reporter questions. The first one coming into the chat is from Rick Rondinone from Hearst Connecticut Media. His question is, should the school mask mandate continue given what is going on across Connecticut? Dr. Wu?
Okay, I guess I can certainly feel that first. I mean, the reality with school mask mandates, let's just go back to the science, okay? Taking out the mandates, masking works. It's a respiratory virus and masking works. And so we also have to take that in the context of perspective. And so even though the numbers are much better, we're still not in the right place that we need to be at this point. So, you know, there is kind of this, well, this will be my first movie reference in quite some time that I haven't used, but I've used this reference before where when numbers got better, I go back to old school and you got Will Ferrell running naked in the street. We're not at that point where we can be Will Ferrell at this point. And so it will be dependent on school districts. It will be dependent on, I guess, the tenor of what is happening in that district. But looking at the science standpoint, masks certainly work. Whether or not it is time to get rid of those mandates, that remains to be seen. And it also remains to be seen what direction that we're heading in. Now, we are certainly headed in a downward trajectory at this point in terms of the numbers going down. But like I said, we are still not in a great place at this point. So that's why I'm not a politician and I can't make those decisions. But from a science standpoint, it certainly makes sense to have masking. When to remove that masking, that remains to be seen at this point.
Our next question comes from Mary Catherine, also from Hearst Connecticut Media. Could you speak to testing demand on the Hartford healthcare system? And with SEMA4 officially withdrawn from processing tests at the end of January, will that have an impact on testing at Hartford Healthcare?
I think I'm going to have to field that one as well. Where's Ajay when you need him? But so the reality is that the testing demand still does remain robust at this point, but we are able to handle it. And with the withdrawal of the processing of the SEMA4, I don't think that it's going to be an issue at this point.
Nicole Leonard, question from WNPR Radio. What do you think the best way will be to administer this vaccine if and when it is authorized to these very young kids? By pediatricians in their offices, in public vaccine clinics, open to all, etc. Dr. Benzoni, do you want to start with this, Eric, and then maybe we can have you weigh in?
I would like to address that. I obviously am very biased that I do think it should be done in the pediatrician's office. We know these families. We would be the ones to handle this, any kind of questions or side effects that come down the pike. And what we do all the other immunizations, why would we not do this one? It would lend more towards a normalization also. of this vaccine. To put it in a different setting would make it more foreign to the parents
And to the children.
and to the children. Yes.
Eric, do you want to talk about that rollout process in terms of getting it to the pediatrician's offices?
Yeah, I agree 100% with Dr. Benzoni. I think the expertise needed to give vaccines as the children get younger really kind of gets away from the mass vaccine clinic kind of a setup. So we would be looking to work with the pediatricians that are part of our network and support them. We can manage vaccine logistics for them or assist them with the vaccine logistics. I haven't seen yet the stability data on the new vaccine. I would guess that it's probably going to be the same as the pediatric vaccine. I would hope that it's good for 70 days in a refrigerator. So that will help a lot. The other thing that we'll have to see is what size packages it's available in. Sometimes when a vaccine first comes out, they put it in bigger packages just so that they can ship it out faster. That's where I think, our system team can help break those packages down and send smaller amounts to our pediatrician. So again, I think when we get more information on all the specifics about the young child vaccine, we'll have more of an answer on those questions.
Our next question comes from Eliza Fawcett at the Hartford Courant. Dr. Wu, how would you explain to the public why death rates continue to be high, given that Omicron is receding and Connecticut is a highly vaccinated state?
Right, great question, Eliza. So we've talked about it on the previous media call, how society tends to approach these diseases. It's very binary. It's either a 1 or it's a 0. It's either really, really, really deadly or it's not deadly at all. And the reality is with Omicron, it is more mild than Delta, but is certainly not deadly. Did I just use a double negative? So it is certainly still remains the possibility to cause severe disease and can be lethal. And by the sheer numbers of Omicron, because it is more transmissible, you're going to have higher numbers of people that are going to be infected. Now, you may also have higher numbers of people who do perfectly fine, but because of that, we're still going to see an absolute rise in terms of the numbers of people who do well. Now, why is that happening in a highly vaccinated state? Well, we talk about relativity, right? We talk about Einstein and the theory of relativity at this point, and it's all about perspective. And so, yeah, we are a highly vaccinated state. When you compare it to other vaccinations, our COVID vaccination rate, even though one of the best in the country, is really pales in comparison to where we would like to get when it comes to vaccination rates. And Dr. Benzoni can certainly attest to that for some of the other diseases that we give vaccines for. We want to get above 90%. And so if you only have a 70% vaccination rate, and a lot of them are not boosted, I shouldn't say a lot, but some of them are not boosted at this point, you're going to get infected, and those sheer numbers are still going to result in morbidity and mortality.
Our next question comes from Dominique Moody at NBC Connecticut. What could the emergency use authorization for Pfizer vaccine potentially mean in the fight against COVID-19?
I think to Dr. Wu's point, it's going to give us the ability to increase that number. I don't know the exact number of children between 6 months and 5 years in the state of Connecticut, but it's another slice of the pie, if you will, that can help us creep closer to 90%. When you have to exclude age groups, when you're trying to reach an overall population vaccination rate of 90%, it becomes virtually impossible. So looking at it at the 60,000 foot level, 6 months is probably as far down as we're going to go with the COVID vaccine in terms of age range. So when this becomes available, we will at least be able to have had essentially all people who normally we would vaccinate be eligible to receive an authorized or approved vaccine.
Dr. Wu, anything to add to that?
I was going to let Dr. Benzoni talk because
Dr.
I think
Benzoni?
it would really benefit her population. I can chime in.
And I agree. One of my thoughts as I'm sitting here listening to you is I know the resistance I'm going to get from parents, and it's going to be from the very young patients. I think 2 on up, 2 to 5. I think if we could do it in a more stepwise fashion, if we did the 2 to 5 and then we did the 6 months to 5 years old. I mean, I don't know how many of you guys have young kids, but these kids are getting a lot of shots in the first 15 months of life. And to add 3 more, it's going to be a hard sell to parents, especially when they see that the hospitalization rates and death rates for children is relatively mild. They're thinking not so much about the general good of the general population for the most part when it comes down to such a young kid. They're thinking about their own child and the potential impact on that child. And then, but when you get to the older age groups, a lot more people are thinking about the 90% vaccination rate that we're trying to reach. So I feel like a rollout of 2 to 5 rather than 6 months to 5 years old would probably be a little bit more robust, a little bit more doable. I do think the 6 months on up is going to be a hard sell for parents.
Dr. Wu?
Yeah, so I think I'm just going to reiterate what Eric said. I like the pie analogy. Pie. That'll probably be our next variant too. But anyways, if you decrease that pie, or increase the amount of people that are vaccinated. So we've always talked about vaccination in terms of protecting against morbidity and mortality. And Dr. Benzoni is absolutely right. Certainly, children are not suffering as severe consequences as when compared to the adult population, though we do see a rise in pediatric hospitalizations and ventilator utilization as well, unfortunately. But we've talked about vaccination as a personal choice, but as you've heard me talk about in the past, this is a personal choice with a societal consequence. And so even though its point is to prevent morbidity and mortality, it does prevent transmission to a certain extent. And we've always talked about, and Dr. Benzoni, I'm sorry that I referred to it this way, but with my kids, I've referred to them when they came back from daycare as petri dishes sometimes.
Yeah.
And so that is one of the things that we can hopefully transmit, that, we don't get grandma and grandpa sick if we can get this age group vaccinated at this point. So I think the more we can get that number up, it's just better for society.
Our next question comes from Leslie Gooden from WFSB Channel 3. Can you explain in simple terms for parents why and how this new potential Pfizer vaccine for kids under 5 will be different than previous vaccines? Why does this matter in moving forward? Dr. Benzoni, do you want to start?
Well, I'm not sure that it really is all that different. I mean, it is a different technique, the messenger RNA immunogenicity. I'm not sure that it's all that different for parents. And my explanation would be, it still provokes an immune response, an antibody response. So that would be really no different. I think for them, and I'm just going to keep saying it, it's just the addition of 3 more vaccinations for these kids who already are getting so many immunizations. And the parents, and I understand Dr. Wu's point that it's a societal responsibility, societal good, but sometimes that gets lost when you're looking at your 6-month-old, that does. And that's why, and I understand also the whole slice of the pie thing and getting the higher numbers vaccinated, but that's where I would say from 2 to 5, yes, it's more incremental. But if parents see the data from 2 to 5, and at 2 years on up, they're not getting the immunizations that they are when they're 6 months, when they're 8 months, when they're 9 months. I really feel that 2 to 5 is going to be probably a fairly good response. I think 6 months to 2 months is going to be very difficult for parents to accept another shot for their child. And talking about, I want to go back to one thing we brought up before, is who should administer the vaccinations. I just want to tell all you guys, and I'm sure you already know this, but when you give a vaccination to a child, you're not just giving it to the child, but you're giving it to the parent too. And you're dealing with a parent reaction as well as a child reaction, an emotional reaction oftentimes.
With that, I do not see any other questions in the chat. I do like at this time to go around and have you provide final thoughts just to kind of wrap everything up. Dr. Benzoni, let's start with you. I mean, it sounds like, this is a very personal decision that parents need to make and consult with their pediatrician. Your final thoughts.
I'm waiting to see more data come out. I'm going to be very interested in the next couple of weeks to see which data comes out, and that will help me guide my parents.
Thank you, Dr. Benzoni. And Eric, sounds like you are going to be monitoring ACIP and the FDA, or FDA and ACIP in going forward in terms of when this could possibly be rolled out. Your final thoughts.
Yeah, I would just remind everybody, I think I agree with Dr. Benzoni. We're all really interested in seeing more data and data after a 3rd dose. It takes time to get a vaccine out and into place to be able to be used. So working through those logistics in the month of February, is something that we'll be focused on. And in an ideal world, what I would like to see is that we have the vaccine in our possession when that authorization comes through and as new data comes out. That might make people more comfortable with proceeding, so that we're not spending, say, 2 to 4 weeks waiting for all the logistics to catch up with the release of more data. So that's what our focus will be through the month in February.
Interesting to see what happens. Dr. Wu, final thoughts?
Yeah, I think, one of the biggest questions that I often get personally asked is, would you have your kids get the vaccine? Would they get the first 2 doses? Now my kids are older, so I should say that they are teenagers, but they are fully vaccinated as teenagers. And if I had to go through the 2 to 5 age range, oh my goodness, I couldn't even imagine going through the ages 2, 3, 4, 5 again. But if I had to go through that again, I certainly would have no problem with them getting vaccinated at this point. But I think Dr. Benzoni's point is very astute in the sense that there are choices that are going to be made. But I would say that hear it from a lot of different voices that may be able to provide it to you, because even though you may trust your provider completely, there may be another provider that says something different. So I would take all of it in its totality at its point. But I'll give you another TV reference, CSI, right? Follow the evidence. And so that's what we like to do. Let's follow the evidence and let's make sure that the science is sound with this. And if the science says yay, then we go yay.
All right, Dr. Wu, thank you. Our Chief Epidemiologist here at Hartford Healthcare, Eric Arlia, Vice President of Pharmacy here at Hartford Healthcare, and Dr. Lucia Benzoni, a pediatrician here at Hartford Healthcare. Thank you all for your time and for the media to join us this afternoon for this media briefing. We'll see you all again real soon, but for now, as always, be well.